Hi guys, it's me, Professor D, and welcome back to my YouTube channel. On this video, we're doing another Kahoot. It's going to be very short, just about 10 slides, but we're going to be going over just important concepts to know for the PNVN student, whether you are studying for your exit exam or for boards, just important things that have been seen very often, often enough that I'm talking about it, that you need to know. Now, before we get started, as always, I'm going to ask you to please support me and support this channel by liking this video. You're going to love it. Go ahead and give it a thumbs up now so you don't forget. Subscribe to my channel if you haven't done so already. And be sure to check out my website, nexusnursinginstitute.com. There, I have so many great resources available for you. I have my audio lessons. I have my new book that is out, Nexus Nursing's NCLEX RN cheat sheets. And in that book, it's basically a compilation of study guides, but I point out to you the most important things you need to know before you go take that test. If you don't know anything else, you better know what I have highlighted in that book. If you haven't gotten yours yet, be sure to go to my website and order yours today, nexusnursinginstitute.com. Very shortly, the one for PNVN will be out soon. So, guys, I'm seeing your emails, I'm seeing your DMs. I'm only one person, but it's coming out soon. Give me a couple of weeks. The one for PNVN will be out again, nexusnursinginstitute.com. That's the website where you can get your copy. Also, you can find me covering a variety of topics across my social media platforms almost daily. TikTok, Instagram, Facebook, YouTube. My handle is the same everywhere, Nexus Nursing. So be sure to check me out. Without any further ado, let's get started. Okay, first question. Concepts for PNVN students. Select all that apply. All right, loop diuretics lead to profound excretion of what? Let me move this out the way for you. Select all that apply. Here are your options. Water, sodium, chloride, potassium, calcium, magnesium. Again, loop diuretics lead to profound excretion of which electrolytes? Select all that apply. What do you guys think? We're talking about loop diuretics. If you're not into the Kahoot room, you can just type on the live what you think the answer is. All of them, guys. All of them. When it comes to loop diuretics, all of these electrolytes are lost in the urine. Now, with that being said, the fluids, sodium, chloride, potassium, calcium, magnesium, if you had to choose two that take priority over all of the other electrolytes that are lost in the urine, what are the two electrolytes that you guys would choose? Tell me on the live. Type in your answer, guys. Tell me. You have to choose two electrolytes. Which ones take priority? Which two would you choose? Are you guys shy? Okay, no one's answering me. So let me tell you what the answer is. When it comes to two, if you have to prioritize, every single day of the week, it's going to be sodium and potassium. The matter of fact, let's say we're not even talking about loop diuretics, just across the board. When it comes to electrolytes, most of the time, it's going to be sodium and potassium. They're going to be prioritized over the other electrolytes. Most of the time, not all of the time. Okay, because sometimes we're talking about maybe if the patient has a disorder such as I'm trying to think. Maybe if there is a disorder with the parathyroid, right? Then we're going to be concerned about calcium or something like that. But just generally speaking, if you have to guess and you don't know what the answer is and you have to prioritize, the two is going to be sodium and potassium. Now, out of those two that I just told you, you're going to prioritize. What if you have to choose one out of those two between sodium and potassium? What are you going to prioritize, guys? If you have to choose one between sodium and potassium, what are you going to prioritize? And whenever you're thinking about prioritization, remember, you have to think about what's going to kill your patient the fastest or keep them alive the longest. So guess what you're going to be prioritizing? It's going to be potassium. Potassium, whether it's too high or too low, remember your therapeutic range is 3.5 to 5, right? It will cause cardiac dysrhythmias. It will kill your patient a lot faster than sodium being too high or too low. Okay? All right, let's move on. What is the number one way to assess changes in fluid status? Would it be I&O? Would it be daily weights? Would it be skin turgor? Or would it be taking the patient's blood pressure? So let's say your patient has a condition such as congestive heart failure, or they have diabetes insipidus, or they have SIADH, whatever. They have a condition where you really have to monitor and pay attention to the changes in that patient's fluid status. What is the number one way to assess a patient's fluid status? Would it be I&O? Would it be daily weights? Would it be skin turgor? Or would it be blood pressure? By the way, guys, those three conditions that I just mentioned to you, you also need to know that for NCLEX. You need to know that those are conditions that you're going to be very closely monitoring the patient's fluid status. Daily weights. Very good. Daily weights. You are going to take that patient's weight using the same type of scale, same type of clothes, same time in the morning. Okay? Daily weights. True or false? Hydralazine is used to treat mild to moderate hypertension. Is this true or is this false? Hydralazine. Is hydralazine used to treat mild to moderate hypertension? True or false? Guys, it's false. More of you guys said true than false. This is absolutely false. You guys need to know this drug. You have to know hydralazine. Hydralazine is a direct acting vasodilator. This drug is strong. It's not your first or even your second go-to drug when it comes to being used as an antihypertensive agent because it's so strong. It's used for moderate to severe hypertension. Okay? It directly relaxes the smooth muscle, but the adverse effects are so significant. That's not our first or second go-to. Moderate to severe hypertension. We have way better drugs on the market with less severe adverse effects, right? We got our beta blockers, we got our ACE inhibitors, we got our calcium channel blockers. All right, true or false? The antidote for heparin is vitamin K. Is this true or is this false? The antidote for heparin is vitamin K. True or false? Is this true or is this false? The antidote for heparin is vitamin K. It's absolutely false. The antidote for heparin is what? Protamine sulfate. You need to know the antidote for heparin, which is protamine sulfate, and you need to know the antidote for Coumadin, which is vitamin K. Vitamin K goes with Coumadin. Protamine sulfate goes with heparin. So the patient who's taking heparin, what are you going to be watching out for? What are you going to be monitoring for? You're going to be watching out for bleeding and bruising and thrombocytopenia and hypertension, right? You're going to be checking the urine and the stools. And if they brush their teeth and they spit out, you're looking at the saliva, make sure it's not pink tinge. You want to make sure the patient doesn't have any internal hemorrhage going on, right? You're going to be looking at the vital signs. We don't want to see the blood pressure going down and the heart rate going up, right? When we look at the labs, we don't want to see the RBCs going down and the H&H going down. We don't want to see those signs and symptoms of that patient bleeding internally. You better know those clinical manifestations. Type in your answer. The therapeutic level for digoxin is zero point 0.2 to what? The therapeutic level for digoxin is zero point 0.2 to what? What is the answer, guys? For NCLEX, you better know what digoxin is. There's not too many questions on NCLEX that wants you to know directly what the drug class is. Guess what? Digoxin is one of them. You better know that drug class. You better know the therapeutic range, and you better know those signs and symptoms of dig toxicity. Don't say I didn't warn you. The therapeutic level for digoxin is zero point 0.2 to what? 2. You guys need to know this. So you guys need to know that digoxin is a cardiac glycoside. You need to know that it's a wonderful drug for, so if your patient has CHF, it's a wonderful drug because it increases the contractility of the heart. You have to know what that drug action is. And you also need to know the signs and symptoms of dig toxicity. So, blurred vision or seeing like halos or, green or the patient having bradycardia or dizziness. You need to know that. I don't think I mentioned the bradycardia to you. You need to know. So, yes, the action, it increases the contractility, but it also slows the heart rate. You give digoxin, you better be taking that apical pulse for a full minute. Okay. Type in your answer. Iron, ferrous sulfate, iron given intramuscularly should be administered via blank track method. What is the method that you're going to give iron when you're giving it IM? What's your answer, guys? I'm not seeing anyone on the live type their answer. You guys don't know what the answer is? Very good, Jennifer. Thank you, Danilo. Very good. Taiwan. All right. Z track. How you gonna put false? This was not a true or false question. So you're going to give it Z track method. You need to know that. So iron is very irritating, guys. And so you want to make sure that you give it deep in the muscle. It will cause a lot of irritation if you accidentally give it subcutaneously. We need it to be absorbed. It's going to be given deep in the muscle. We want to decrease irritation and we want to decrease staining. You're going to give it at a 90-degree angle. And what's the preferred method for IM, iron administration? Ventrogluteal, that is the preferred method. Okay. So you need to know that for IM. What do you need to know for NCLEX when it comes to PO? Well, you need to know that it needs to be given on an empty stomach with ascorbic acid, vitamin C, orange juice, lemonade, right? Because that vitamin C, that ascorbic acid, that's what makes the iron be absorbed. You need to know that it's very constipating. So you're going to teach the patient to drink lots of fluids, eat lots of fiber to ambulate. We don't want them to be constipated. If it's given liquid, you're giving it to a child, you're going to have them take it through a straw so it doesn't stain the teeth. Am I missing anything for oral? I think that's about it. Nothing else I can think of. Did I tell you empty stomach? Empty stomach, no food, but with vitamin C. So make sure you know your nursing interventions if you are giving it PO versus IM, okay? Oh, there was something else. Something else you need to know is that it's very dark and it will cause the stool to be a very dark color, and you have to warn them or they'll freak out. True or false? A rare but serious adverse effect of ACE inhibitors is angioedema. Is this true or is this false? Yes, Sunshine. Sunshine says brush teeth after. Yes, if you're taking the oral iron, make sure you brush your teeth after. We don't want it to stain your teeth. Yep, that's a wonderful nursing intervention. True. A rare but very serious adverse effect of ACE inhibitors is angioedema. We're going to be concerned about swelling of the face, swelling of the lips, swelling of the tongue. We don't want airway obstruction, right? So you need to know that, and you need to know what's contraindicated. We don't care that the provider ordered ACE inhibitors for this patient. If they ordered it and we look at that patient's chart and we see that that patient is pregnant, HCG is positive, patient has a history of angioedema, or patient is hyperkalemic, are we going to give this drug? Absolutely not. We're going to withhold this drug and call the healthcare provider. ACE inhibitors can cause the potassium to go up. So if the patient is already hyperkalemic, remember, potassium 3.5 to 5, anything higher than 5, you have hyperkalemia, you're at risk for cardiac dysrhythmias. Do you think a patient that is already hyperkalemic, it would be a good idea to go ahead and give them this drug? Absolutely not. You don't want to lose your license, because when you're standing before the Board of Nursing, you cannot tell your state Board of Nursing, oh, I gave it because a healthcare provider ordered it. Nope. Did you check the labs? How did you not notice that the potassium was already high? You need to know that this drug can cause hyperkalemia, and a direct contraindication is hyperkalemia. Okay? Which phrase indicates psoriasis? Pruritic vesicular rash, butterfly rash, honey colored crust, or silvery white scales. By the way, each of these four phrases that I put, you need to know them. I just happen to be asking about psoriasis, but you better know those other options as well. What phrase here, the minute you see it, your mind needs to go to psoriasis. This is what they're talking about. What is it, guys? Tell me on the live. What do you think your answer is? Very good. Silvery white scales. The minute you see silvery white scales, you know they're talking about psoriasis. Another famous question you guys need to know. Let me ask you something. Is psoriasis contagious? Tell me on the live, yes or no. Is psoriasis contagious? I'm waiting. Quickly. Yes or no. Is psoriasis contagious? You guys are killing me. So no, the the answer is no. Psoriasis is not contagious, so you have to teach the patient that. Very good, Avery. Avery said one of them is impetigo. Do you know which one that is? So let's go through all the other ones, guys. Let's go through the first one. Pruritic vesicular rash. Pruritic means itchy. Vesicular. Whenever you see that word vesicular, 90% of the time they're talking about something that is of a viral nature, and you guys know what rash is. When you see pruritic vesicular rash, I want you to think of what? Chickenpox. I want you to think of varicella. I want you to think of chickenpox. What about butterfly rash? When you see that phrase butterfly rash, what should your brain immediately go to? Lupus. And last, honey colored crust. When you see honey colored crust, you should be thinking of impetigo. And guess what? Impetigo, it absolutely is contagious. Patients going to have to, they're going to be on topical antibiotics for a full 24 hours before they can go back to school or work. It won't be contagious. Avery, we are answering. No, you guys are not answering me. I am looking at the live. Nobody's answering me. I'm answering myself. Nice try. All right, guys. So make sure you guys know these phrases for each of them. All right, true or false? Bisphosphonates should be taken with food. Is this true or is this false? Bisphosphonates should be taken with food. That looks like, what's that? Pork chops or salmon with French fries, rice, baked beans, and orange juice. What kind of meal is this? That doesn't look too appetizing to me. Okay, anyway, bisphosphonates should be taken with food. That is false. Bisphosphonates should be taken. Oh, thank you, Shauna. Shauna says there's a delay. Okay, thank you. I'm sorry for yelling at you. It's not your fault. So bisphosphonates should not be taken with food. It should be taken on an empty stomach. Why? We don't want anything to mess with the absorption. So you're going to take it on a couple things you guys got to know about this. You're going to take it on an empty stomach with a full glass of water, and you have to stay remaining sitting, standing for an hour. You cannot lie down because it is very irritating and corrosive, and the lining of your esophagus cannot handle it. It will burn. Okay? Very important for you to know. Patients who are taking bisphosphonates, their bones are porous, right? They have I was going to say osteoarthritis, and that's not the word I'm looking for. Osteo what? Not osteoarthritis, osteomalacia, osteoporosis. Oh my gosh, I can't think. The osteoporosis, porosis bones are porous, right? So instead of all of the calcium being in the bones, making the bones strong, the calcium's not where it needs to be, and the bones are weak. And so this patient's taking bisphosphonates, again, empty stomach, full glass water, and must remain upright for a full hour. Thank you, osteoporosis. Yeah, these types of patients, you're going to teach them about weight-bearing exercises. Why weight-bearing exercises? Well, weight-bearing exercises such as walking pushes all of the calcium that was hanging out in the bloodstream back to the bones where they belong to make the bones stronger. All right, last one, guys. Select all that apply. What kind of communication is considered therapeutic? Select all that apply. Here are your options: active listening, silence, open ended questions, giving advice, interrupting, and offering opinions. So, which one out of these are considered therapeutic? Again, your options are active listening, silence, open ended questions, giving advice, interrupting, and offering opinions. Which ones are considered therapeutic? We're going to go over this, and then I'm going to explain to you how NCLEX may try to trick you so you don't fall into that trap. Okay? Okay. Let's go through each of them one by one. If you've been following me for any amount of time, I say this a million times: when you're doing select all that apply, you treat them as true or false. That's how you get them right. So active listening, true. Silence, true. Silence is offering self, right? You're being quiet to allow that patient enough time to formulate their thoughts and be able to express themselves. But there is an exception to the rule, guys, and you have to know this exception. I don't want you to get this question wrong. Even though 95% of the time silence is therapeutic, what about if that patient's putting themselves down? That patient says, I'm so ugly, no one's ever going to want me. And you, as the nurse, you don't say a word. You're like, and you're quiet. Is that silence therapeutic? No. Because if the patient's putting themselves down and you're being silent, guess what? You're telling the patient that you agree with that thought. So even though silence is therapeutic, not when the patient is putting themselves down. You better open your mouth and say something. Open-ended questions, is that therapeutic? Yes. You want the patient to express themselves. But there are situations where open-ended questions is not therapeutic. This is not the time. What are they? I'm so happy you asked. Emergencies. If this patient's being rushed into surgery, and we need to know, have you had alcohol in the past 24 hours? Are you taking metformin? Are you on blood thinners? There are certain things we need to know in this emergency. It's yes or no. It's a closed-ended question. So you're not going to ask open-ended question. In that situation, it's not therapeutic. What are the other two? Abuse. If you suspect abuse, you ask them directly if they're being um, injured or harmed by anyone. Yes or no. And the third one is suicide. Are you having thoughts of harming yourself or anyone else? Yes or no. Okay. Now, outside of that, yes, open-ended questions is therapeutic. But in those three situations I mentioned, you better not. You get that question wrong. How about giving advice? That's never therapeutic. Interrupting the patient, never therapeutic. Offering opinions, never therapeutic. It's all about the patient. You ask them what they think. You help them. They need to formulate and come to their own conclusion. You never offer judgments or opinions in nursing. Okay? All right. Let's see how you guys did.